Okay, so as the facilitator of this conversation, I have a commitment to each of you, which is to hold a space of curiosity and listening and care. I'm doing this because I personally care about the NM community and those of you who yourselves are affected by NM. And so I want to offer my presence and my skill set to invite a respectful and truthful communication. I think that this will really help us to learn from each other's unique points of view, experiences, concerns that we may have, any fears that we have, and especially the ideas that we have. So one of the ways that I think that will enable this to be meaningful, to be respectful, and for us to get as much done as we can in a short period of time is if we all agree to remain curious during this conversation, to really listen openly to each other, and also to express care. So that's care for one another, that's care for ourselves, and it's care for this larger community, especially those that aren't on this call. I just want to restate the purpose of the call. I'm sure you all know what it is, but I feel like it helps to say that. So a foundation building strength is inviting us all and members of the NM affected community to participate in this listening session. So as representatives, we can also acknowledge any past errors. We can offer a space for communication, and we can hear ways that we can basically do this better. So we have an hour, which we're already into. And then the rest of that statement is that we hope to move forward towards healing what is at sometimes a fragmented community and to create mutual understanding and a more unified advocacy movement that includes the support of promising research. A foundation building strength understands that there are members of the NM community who may hold negative views or opinions of the organization. So we want to better understand the history of those views and to hear what the needs and desires are of people so that we can have more open lines of communication and we can increase the possibility of sharing and aligning more of our goals, our actions, and our aspirations. So that's really where we're coming from. And I also just want to say, terrific. So I also just want to say that in my experience, which is a much more limited experience of what it means to be living with NM, that everyone in this community is affected differently, right? There's many key factors that are going to influence that. So some of them are maybe the age of onset when you received a diagnosis, or even what that diagnostic journey was like that you went on as an individual or went on with your family. Kind of what were the events that led up to even learning what Niemann myopathy was and how it was going to impact your life. Other key factors, of course, are geographic location, a socioeconomic status or your upbringing, and therefore how that impacts the access that you may have to therapies that are helpful, to caregivers, medical specialists, access to assistance devices that may be helpful for ambulation, transportation, your breathing, and just general health and how you manage your body. There are cultural, racial implications. There's all sorts of things at play that in ways, I don't want to say divide us, but differentiate the experience that you're having. And even though those are all things that, again, differentiate you within this community, or if you're a caregiver for a child versus an affected individual who's an adult, these are things that also connect us because it's from our own unique experiences that there's a community here. And so basically, as we talk today, I thought that we could do our best to speak from our own unique viewpoints. And something that can help in that is simply to say I when making a statement. So I'm just going to start by making an example of it, and then we can go around, we'll introduce ourselves, and we can really begin. So I just want to say that I feel honored to have this opportunity to be here today, to listen and to learn from you all. I do not have NM, nor do any members of my family. So in that way, I'm probably quite different from most of you. But I do have something that's important to this conversation, and I believe that that is why I'm here. So what I would like to do now is for us to go around. We can take up to 1 minute, and I want you to just say your name, and then you can complete this sentence, I am here to, or the reason I am here is because. And what I'll do to keep this really quick and succinct is after you have spoken, it's called popcorn, you will popcorn it over to somebody else. So I will begin, right? I just said who I am and why I'm here. And I'm going to popcorn it to Carol. And Carol, you'll say your name, I am here too, and you'll say popcorn, and then somebody else's name that hasn't gone yet.
Levi, if I could just
Mark,
ask,
please.
just if anyone feels more comfortable writing their intro in the chat, if that's something that's easier for you, please feel free to do that. If anyone needs to write it for you as well, totally, we can read it out. Thank you for everyone for being here. Carol, please.
Thank you for that, Mark. And if this feels too concise and there's more you want to share that you don't have the time to speak or write, let's utilize the chat as a resource for all of us. So I will begin by passing it to Carol.
So I'm Carol. I live in the Bay Area, California. I'm 59, diagnosed in 2012. As an adult, have a daughter with the same TPM2 NM as I have. Goes back generations in my family. I am here to meet and talk to other adults with NM, different who are affected differently by NM, and also to find out more about the organizations that exist, the web of organizations that seems to exist in the research and online community. And I'm popcorning to just pick a number like this, Lucinda.
Hello, my name is Lucinda. I live in North Carolina. I'm 25. I have NM. I don't know, I just came to listen to the session. I didn't really feel like I needed to say anything, but I just was here to listen and hear from people, hear what others had to say. That's all. And I'll pick Brandy.
Hello, my name is Brandy, and I'm from Virginia. I'm 30 years old. I was diagnosed with neuromyopathy when I was 2, and I just came to connect with other adults and just learn and see what else I could learn about neuromyopathy and just meet new people, because I don't really know any other adults. I really don't know many other people with neuromyopathy, especially in my area. So I just came to meet people and learn. And I will pass it to Alexandra.
Hi, I'm Alexandra. I am 33 and was diagnosed in 2007 when I was 17. And I have the NEB type. I'm here because I want to connect with other adults that are living through this rare condition, and just like connect and find shared experiences and in ways we can, get through every aspect of it, and just make connections and help each other. And then I would like to, popcorn to Mary.
Okay, hi, I'm Mary. I'm 75 years old. I was born with Nemeline myopathy, so was my brother. But of course, nobody knew what it was until I was about 25. Never met anybody else that had it, so this is very exciting. I have 3 daughters. At this point, they don't have it, but they're just starting to have kids of their own. Anyway, I'm delighted to see everybody. And I
Thank
would,
you, Mary. Do you want to choose someone to pass it to?
sure, Carol.
I think we already had Carol. How about if,
Did, oh, okay.
how
Who-
about Melissa? Melissa,
Melissa, yes, Melissa.
Hi, I am Melissa. I live in Omaha, Nebraska. I'm 48 years old. Thought I had NM all my life, but just this last week, I got genetic test results, and I do not. I have the Selenon genetic variant, so, but I'm still here. I still feel part of the NM community. You won't get rid of me yet. Anyway, so I'm learning a whole new identity that is kind of mind-blowing. But today I'm here to listen, provide any input that I can, and just see where the conversation takes us. I will pass it to Sharon.
I think I see Sharon on a phone call.
Okay.
And she wrote in
She
the
put
chat.
her intro in the chat. If
She
someone
wrote, yeah.
wants to read it.
why don't we pass it, if it's okay, to Richie, and then when Sharon's ready, maybe she can join us.
Hello, everybody. My name is Richie. I'm 52 as of yesterday, and diagnosed in 2018. My father also had the condition as well. That's about it. I'm here to learn from everybody else, particularly in the same age group, what things to do to improve the diagnosis. Thank you. Levi, do you want to hand over to somebody else?
Sharon, are you back with us? Do you have a moment to introduce yourself?
Hi, can you hear me okay?
Perfectly.
Hi, I'm Sharon Smith. I'm from Massachusetts. I'm the mom to two sons that have Nemelin myopathy. One is age 21, the other is age 17. And I'm here because I am just phenomenally impressed with the foundation building strength and all that Mark and his entire team has accomplished over the past several years. And I'm here to learn what other people are doing. We still need to get genetic confirmation for the specific gene. That's of ongoing interest to me. As my boys get older, I think they're going to want to know the gene variant. Other than that, I'm just here to say hello to everybody. And I think you're all wonderful people. I've been friends with a lot of these people through email and other things over the years. And it's really, really nice that you get everybody together to meet everybody this way. So I just want to thank you all very much.
Well, thank you. I'm not sure, I don't want to miss anyone that's joining the call that's not part of the AFBS staff. Is there anyone that we didn't hear from yet?
Levi, I think Anna.
Anna, great, thank you.
Hi.
Hi, Anna.
Hi. I'm laying in bed because it's start to get nighttime over here. I guess I'm the one that lives most north of you all, but I'm very happy to join. My name is Anna. I also have NM. I was born with a muscle disease, but I was born 52 years ago soon. I have my birthday next week. And at that moment, they had no idea what NM was. So after 2 years, I was diagnosed with SMA instead. And at that time, they also gave my mom, who died 2 years ago, SMA. But after an accident I had in Australia, they found out, because then they started to do gene testing on me. They then found out when I was 25 that I had NM. And I also have a teen daughter now, but she's 13 and she also has NM. and I'm in here for everything everybody else has said, but I also hope to can contribute to that. Except of being a mom with NM, I have also been a daughter of someone with NM, except having NM myself. So I think I have many perspectives of NM, not just of having it myself. I've seen my mom struggle. I've seen my daughter, or I see my daughter struggle now when she's a teen, and the way of living with NM as a mother. Can I just have 30 more seconds?
Please.
Thank you. The only thing that's hard for me to share with you, since you are Americans, most of you, is that you talked about in the beginning, Levi, about healthcare and AIDS and so on. Over here, everything is for free. So we don't have the same struggle, or it doesn't matter if I'm rich or if I'm poor in my country. I don't need to have special insurance to get a special wheelchair or get health care or get an operation. Everything is free. When I did my spine surgery from the shoulders down to my pelvis, I was in first ICU, and I've stayed in hospital for very long, and I know it costed Sweden taxpayer millions of dollars. And for me, it only costed 10 pounds per day, and that was for food and bed. It was like boarding, bed and breakfast. And so it's so different, the system we have up here in Scandinavia than you have in the rest of than you have in the United States, or it's even different from UK or Australia. Even if UK and Australia is a little bit better than United States in that case.
Right.
So
Anna, thank you. Yeah, I feel like with so much of what each of you said, we could go an hour. So
yes,
what I want to say, what stood out from hearing each of you, and the reason we're not going to take time to hear from the individuals specifically who work with the foundation building strength is just so we can make best use of our time, and many of their bios are available on the website, and we can be in email contact with them. So it's not to by any ways decentralize their voice, but it's to focus your voices all here as guests. So Anna, thank you for that. I mean, hearing from each of you that not only are there celebrations like birthdays in the space, but that so many of you are here to listen and to provide insight. I also heard many of you say that you really just generally want to connect with other adults along a shared experience and to hear what their experiences are and to get the opportunity to meet others, be it virtually or hopefully in person. And then so much of what you touched on, Melissa, is a whole other piece, which is what aspect of our identities are enwrapped in how we relate to this genetic condition and its expression. How does that identity shift over time, either through updates in our diagnostic journey, which it sounds like, Melissa, you just had quite a big one, but also what value and wisdom goes with the time. So I just have to say thank you so much, Melissa, for coming and for still representing and speaking from this community, which you are a part of. And then Anna spoke to something very interesting, which I often call the hinge generation. Some people are, in your case, Anna, you are living with this condition yourself, but you've been a caregiver to an elder generation and a caregiver to a younger generation. And so how do you balance your needs for yourself as an individual with those of your mother when you're caring for her, your children? This is so dynamic. So please know that if we don't speak to the intricacies of all these things, it's not for lack of interest, it's likely for lack of time. And we're taking notes. These could be topics for future listening sessions and resources. So I do want to follow a little bit of an agenda here, which the first bit I think we can move through quickly so we can like really get into the heart of it. But I would like to hear from people, especially if you don't know. So my concept here is that we should never feel bad for being ignorant. For example, someone asks a question, you don't know the answer, like, I really don't know, I feel kind of ignorant about that. Those are actually the voices that are really helpful to hear. It's the voices that know the answer that we want to actually listen to less. So if you are new to a foundation building strength, you don't have much experience with this organization, I would be really curious to hear in your own words what your sense is of what this organization is about. So again, would love to hear from someone first that's pretty new to the organization or to doing a call with us and thinking about how would you describe a foundation building strength? And you could either raise your hand here and Kate can help call, or you could just unmute. Anyone willing to just step out and say, Brandy, I saw your hand go up.
Well, I'm new to the call. I've never been on a call. So I'm just guessing that you guys are here to help give support to people with NM and in whatever areas that they need help with, maybe mentally, or if they need assistance finding any type of assistant devices, just pointing people in the right direction in whatever area they may need support in. That's
Terrific.
my
Thank you. Anyone else? It could be similar, it can be different from Brandy. In your own words, how would you describe a foundation building strength?
My limited knowledge of AFBS is that they not provide. So they work on funding for research specifically for NM, that there aren't other organizations, or there are several other organizations, but not many that do provide funding for research specifically for this myopathy.
Great.
Mostly it's about research. That's my understanding.
Thank you, Carol. I see Anna's hand waving. Anna, in your own words, what is AFBS? Oh, you're on mute.
Actually, I would just want to say what the Swedes said who followed me to New York for ABFS to run the marathon. They have no NM at all by themselves. They are just friends and personal assistants for me on holidays. And for them, ABFS was family. The first time, this was the first time, the first time they met NMers in Tennessee. And they felt so welcome to the community at once, even if no one had any contact with them. And that's how I feel also about ABFS. It's family. You care about each other. And for me, it's really important to raise money. But with ABFS, don't forget the small people at the same time, if you understand what I mean.
Thank you. Yes, I think that's clear. Does anybody else want to just speak on this kind of general topic before we move on, in terms of using your own words to describe the organization? I can say, because I'm also fairly new to the organization, I feel that AFBS is a group of people who genuinely care about the NM community, that they are putting in, again, for the amount of time I've been doing some work with you all, daily work, like hours per day, every day, weekends included. This is a Saturday afternoon. And that though there is certainly a focus, and I see that the focus is some treatment and research-based focus, that doesn't belittle the genuine care for the experience, the resources, and some of the other needs that I think Brandy certainly spoke to. What are some of the other implications and needs for people living with NM, and how might that affect them differently? We've already heard how it can be very different based on your geographic location, what country you're in, what systems and governments and healthcare providers are available and not available. So there's a lot there. So there's a piece about mission and mission statement, because especially AFBS being a US based organization, right? There's a clear mission statement. But that mission statement, because it reflects the needs of a community, as a community grows and changes, sometimes organizations change, or sometimes there's like these points of friction. And so without focusing specifically on that, it would just be really nice to hear, it's a similar question, but how does the mission of AFBS address the core needs of the NM affected community? And what would this mission need to address if they're, as it expands, as we go through our journeys, and as the organization goes through its journey? So similar question, but a little bit different, right? This isn't just in your own words, but this is kind of looking at the mission of what you know of a foundation building strength, and what core needs of the NM affected community does this mission meet or address? It'd be great to hear someone that didn't speak in that last round. And remember, if you don't know the answer, you're the one that I'm wanting to hear from. For those of you that are thinking, even if you can use the chat too, feel free to just write a word. I'll put a word out, advocacy. What does that mean, right? But is advocacy, is that a core need of the NM affected community that this mission addresses?
So you're asking about things that already exist or things we would like to see happen?
Yeah, that's the turn we're about to take. So feel free.
Okay.
I would like to talk about some of the core needs in the community that the mission addresses, and things that we would like to see happen. That's kind of where we're headed.
So you said advocacy, going hand in hand with that would be representation.
And representation, I imagine too, it has to do with visibility, like who is being seen and heard. Representation being who is part of the organization, who is doing the work, who's volunteer, who might be paid. Are there anything else you want to mention about representation?
I was thinking more national representation, more within the medical community and the legislative community, the political community as well.
Great, thank you. Melissa, I saw you come off mute. Do you want to say something?
Oh, I was thinking more mental health related, just with living with a disability in general. We don't have a lot of access or knowledge of mental health available. So that's a big one. I mean, it's hard to live with it, but we do every day.
Yeah, so the offering of support for mental health, both perhaps actual resources that exist, just addressing it, like where Carol said, visibility, or I know that wasn't the word you used, but the other thing is just to acknowledge how even being on a call like this addresses some of the mental health needs, and how that creates a resource. Thank you, Melissa. Other things out there, needs that exist. Oh, please, Anna.
I just really would second what Melissa said, because it's when you go, I mean, as I said, I looked on my mom. I saw her mental state through her ages. I see my daughter, how she's going through it all. So mental health and NM is a real thing, and disability all over. Something I think it's important to see over. Oh, sorry, my English. It's nighttime over here now. So, but to discuss and support each other in.
Thank you.
That's all.
So in this, and I think really through the growth of this community and of this organization, there is and has been acknowledgement that at times in the past, there has been either friction or what has been viewed as the lack of some of this representation and within the adult affected community. And so that's a big reason that we're having this call, is really to give space for you all to connect more with each other, with the organization, and just to listen. So I want to ask too, if there have been any past harms. Often past harms are unintentional. I think it's important for that context, but have there been past harms, intentional or unintentional, that feel necessary just to name or speak about or acknowledge in order for some of the other things that we've talked about to become incorporated? And so this isn't designed to, we're not like gonna completely go in that direction, but again, if there's something that someone wants to name and say, hey, I experienced this, or I heard this, or I felt this, I just want to leave space for that so that we can name the things that need to be named that may be hard to talk about, so that we can move through and again, establish connection, ways to collaborate, and ways to really create these resources.
Well, I don't want to be first again, but here I am. I was thinking about, and I have not experienced this, but I understand that there's a difference between the foundation having being begun by a parent of an affected child, sort of being orientated toward the parents of affected children. And I really appreciate the feelings of the people who have come before me, that that parent of affected children group didn't really open up to hearing from and hearing opinions of and experiences of adults, affected adults. And in order to bridge that gap, I think for parents of affected children to realize that their children will also be affected adults was an important step. And I think this meeting is hopefully a beginning or a middle to that.
Thank you, Carol. I see your hand, Anna, and before we go to you, I just want to leave space for any other voices. This can also be a question. I'm not trying to like drive us in any one direction. So if anyone says, hey, I really don't have anything to say on this topic, but I just want to say something. I want this to be as conversational as possible. So is anyone else aware of a past harm or a feeling, something that needs to be named, so that we can, again, do the type of thing that this call is about, rebuilding trust to enact better practices of communication. And it has a lot to do with the maturation process. I'll say, and then we can hand it to Anna, that there certainly is and has been a perception, which I think has created a division, that the foundation isn't interested in the needs of affected individuals. But what I think is really clear, is interesting to hear you say, Carol, like, is this a middle? Is this a beginning? Clearly, it's not just a beginning, because enough conversations have happened to know that this is a core need and to begin a conversation and to get you all here and to prepare. So really, this is a middle. I think we're always in the middle of something and a journey. And I also understand how the focus, sometimes the laser focus on certain goals, like fundraising for research, can become so focused on one thing that doesn't leave as much space for the other. And so this is really an opportunity to broaden the focus and to see how interconnected everything is. And we were talking about how by increasing visibility with adults in the community and the connection, the collaboration that can take place between affected adults and parents, I think is very interesting, Anna, to hear your representation, because you're all of the things, right? You know, you're living with all of those things. How we can gain more support and guidance, not only in the organization's mission, but what it means for each of you waking up each day, how you encounter your own identity, how you relate to others in the community. So I think at this point, this is a really nice time just to kind of open. And so if somebody wants to share a reflection of anything you've heard said, anything you've heard me say, or something that you're kind of sitting with that feels important to express, this would be a really great time for that. Melissa.
I think perhaps some of the hurt in the past by some folks, or maybe a little bit on me. I'm not a lot. I don't have a lot of issues, but sometimes inherently when we living with NM, hear about cure, and research for a cure, it makes us feel that our lives aren't worthy enough the way we are. And we have lived with it for, 20, 30, 50 years. So we need to feel that we have value with NM, whether there's a cure or not. We still enjoy our lives. It's a challenge, but it's worthy. Now, that's not to say I wouldn't accept a cure. I don't choose this life, but it is my own, and I love it. So I think, it's a fine line of being accepted the way we are and always hearing we need to find a cure. We need research. We need treatment. Because if it will never exist, if we never get to that, we still need to be valued as we are.
Absolutely. Thank you for what I think is not only a clear statement, but a sentiment that I could just see the nodding. So I felt where that landed for me, but I can really only imagine how it did for everyone else. Thank you, Melissa.
Very hard for me to share that.
I would be curious, and this could maybe come from the perspective of Lucinda or Alexandra or even Sharon. As we think about the kind of, I guess what I would call transition to adulthood, what shifts took place, and Sharon, of course, you would be speaking for your sons in this case, so only if you feel comfortable. But Lucinda, a little bit based on your age, and Alexandra, you also being one of the younger members of the group, of changes or things that you saw happen as you matured in age, as there were certain things that maybe you started to self-advocate more for rather than parents or caregivers, and how that voice is important and needed. What's the bridge between the younger affected community, children, into and through adulthood? If anyone wants to speak on that, but I thought the three of you might have a little more perspective at this time.
My transition to adulthood was, and still is, pretty rocky. I was a lot more able-bodied as a teenager, and I was starting to find more independence in a more typical way at the ages of 17 and 18. But then I had a really awful experience at a hospital with the surgery that I had. and lots of things went wrong. And I lost a lot of function after that. So I felt like for me that set me back a lot. So I'm not sure. I mean, I noticed that the transition to the adult healthcare system was difficult because I found that advocating for myself as an adult, and I don't know if it was just if this is just if other people have experienced this, but I feel like the adult system doesn't respect my perspective as much as someone who is advocating for me. I don't know if anyone else has experienced that. I happen to have a really good advocate in my mom who's helped me a lot. And so she's done a lot for me. But I noticed that advocating for myself is pretty kind of a struggle to get people to take me seriously and really understand that I know what I'm talking about. And I'm actually not sure if that answered the question. I think I might have gotten off track, but
Well, thank you, Lucinda. Considering that this is truly a listening session, my questions, though I think they are, I'm thinking about them, they are important. What's more important is what you all have to say. It certainly does. And there are a few polling questions. We want an opportunity to just to, for those of you that maybe haven't felt comfortable speaking yet, to have an opportunity to answer these Zoom polling questions. So Kate is going to begin to put out some polling questions. So for those of us that want to stay here in dialogue, let's do that. And Kate, if you start to put out the polling questions, we could see the answers to those. So can you all see this? Oh, it's changing. Great. So what is the most important topic on your mind right now related to NM? And I would say, while we're doing this, just so we make the best use of our time, if anyone wants to verbally just speak to it, what's one of the most important topics in mind right now for you related to NM? We can even begin a verbal conversation, and everybody can answer too by going ahead and following that link.
Can I ask a question? I can't see the gallery anymore, so I can't see who else is. Tell me if I'm out of turn.
Did you have the question, Carol, or was it Brandy? It was hard for me to tell.
Whoever you guys want to choose is fine with me.
Oh, I was just gonna say my response to this.
Oh, please.
To me, in my mind, I feel like the most important topic right now is just research and trying to get the best medical care, and of course we want to find the cure, obviously. That's like my main thing. But I would just say the most important topic is just getting the right treatment and medical care. That's
Thank you, Brandy.
I do have something to say. It's kind of broad, but I would of course agree with Brandy that a treatment in here is important, and we definitely want to keep working on that. I also think that kind of support for current like healthcare that is ongoing, might well, is important, and as well as and I think AFBS does do a pretty good job with like supporting community endeavors, like with the conferences. I think those are good, but also doing the sessions like this to bring the community together. I think that's important also. Right, that's all I have.
So I had a question. This is a direct question that should be able to be, one of the reasons that I came on here was to learn more after researching this CMDAR and AFBS connected, along with the congenital muscle, some other website that now I can't remember. So in a lot of us are, and I have a 23-year-old daughter who's also affected, and my father was also affected. So this Congenital Muscle Disease International Registry is a registry of and a tissue, and Stacy runs a tissue bank connected with that registry. The people who have tissue in that registry are signed up or registered, consent to be registered, and have submitted email addresses and stuff to CMDAR for use in that, on that level. Can you tell me how CMDAR and AFBS are connected, and if they share that list of email addresses? That was one of the things that I understand was a concern going backward, and I wondered if it were a simple enough to look to ask.
Is there, and I just want to, I think that's a very valuable question, Carol, and with looking at the time, I would just want to ask if there's a member of the AFBS staff that thinks that there could be a concise enough answer, and maybe offline you can have more dialogue about this, because I think that probably will require a slightly longer answer than the time we have left. Mark or Terry, is there anyone that could speak to that?
Gus is probably the best to
Gus?
answer.
Yes, hello. CMDIR is connected with the AFBS. AFBS is part of the consortium that runs the CMDIR, the registry. So the emails, when you sign up for the registry, you consent if you want to your email address and everything be shared with the AFBS. So you have to consent there.
You can
I
opt
also
out. Yeah.
Yeah, I also wanted to just mention that the tissue repository is a separate thing. It's not part of QCMD's registry, and it's not part of AFBS. It's like we get tissue from, if people from either community want to submit tissue, they can, but it's not associated with either of those things. I'm pretty sure that's correct, right?
Thank you both. Yeah.
I think, again, just there is a funding tie, Carol, where AFBS does support the CMDIR, but the information is completely de-identified. So even if someone elects to choose their email, we do not have any access to their genetic information or any other questions. That's kept completely separate. Thanks for the
Anna,
question.
did you have something you want to say? And then also, actually before Anna, I just want to say, I'm on Eastern time, so for me we're at 2 o'clock, but we're at time. I want to say, whenever I'm on a call that's at time, if your plan was, to move right on from here to the next thing, please do. And we will try and wrap in the next few minutes, as well as hear what future topics we might want to have, including just furthering the conversation if that's something that people are interested in. So Anna, please.
Yeah, the things that are going on Facebook with people saying that ABFS is not thinking of adults. And so for me, that has been an issue between individuals. And I think that's important to think about also. It has been like, who started what first? So it became we against them or them against we. And I think that's really, really sad. I joined because of my daughter at first, but then I gained so much information myself as an adult.
Thank you. Thank you for really offering that insight. And I think that's something that that there's sensitivity to, and a growing sensitivity to. And in hearing what everyone, each of you said individually, but also the collective voice here, and I'll just speak for myself, it all sounds close enough to be possible and achievable, especially through conversations like this and the work, the labor that goes in from the AFBS staff. And so I'm just glad again that each of you were here. And I do think if there was a particular topic or something that you did not have the opportunity for us to talk about, hearing about it in the chat would be really important right now, so we can take note of that, as well as just emailing and being in contact with members of the AFBS staff. Maybe Mark or Terry, if you could mention who might be the best person for some of that follow-up, or Kate, if you could put in the chat a couple of things. Brandy, I see your hand and I'll get to you in one sec. And one thing that I just want to name that I was hoping we were going to get to talk about is to look at how each of you choose to or are forced to engage in disability rights, disability advocacy, and how AFBS might support in this. That is a topic that I would love to see further explored. So I imagine there may be others that have interest in that and have a lot to offer. Brandy, I'll pass it to you. And then if anyone else has anything they want to say to the group before we close, we'll have a few minutes open to hear.
Okay, so I just had a quick question. A friend of mine forwarded the email to the link to this call. So I just wanted to know, how am I able to find out about further calls? Is there a group that I can join on Facebook, or should I just go to the website? How am I able to get into contact with, the people that I need to get in contact with so I can be a part?
Great. I'll let someone from the organization answer that. And what I would certainly say is, if you go to the foundation's website and join the mailing list and send an email and just introduce yourself, I'm certain that somebody will follow up with you to things more specific to your question. But if there is a general way to be included and follow along.
Yeah, sure. There's an info@buildingstrength.com is an email that's checked very regularly. And then on the website, like Levi said, there's all different access to the different social media links as well. And I think nemelin.org is one of the other resources that is available that has, all kinds of other access points to different social media groups that exist out there.
Thank you.
If I could, I just wanted to say something.
Please.
Like Melissa's statement before was so powerful that I think early on, when you deal with a child that's medically unstable, you may not always be the best version of yourself. And I think when you react, you may hurt others because you're not taking into into account all of the sensitivities of others and that they might have. And so I think in general terms, I've learned a lot from engaging with the NM community over these years. And I think the organization has hopefully adapted to be better listeners and to take in more information and listen to the people that are most experienced in living with NM. So I think I'd like to say that we're much more open than we may have been before to understanding the struggles that exist out there and how we can be more supportive. I do want to say that, you know, being specific to the mission of finding treatments for Nemaline myopathy is something we've tried to kind of keep making sure that we're responding to that mission, the way we guide decisions and the way we you know, plan our strategies. But we also need to have everyone engaged and involved in order to have a larger impact. I think we will be a better organization if we do it together. And I will say that the researchers also want to know that the community stands together, because they want to see that the numbers do exist to warrant, you know, the financial commitments that go along with sort of funding important projects and testing. So yeah, anyway, so I wanted to say that, and also wanted to acknowledge Stephanie for being on the call, because we didn't do an introduction before. She did say in the chat she and Chuck are here and listening, and their 10-year-old son has NM. So I just want to make sure we didn't miss her.
Oh, great. Thank you for that, Mark, for all the work that you do for the organization. Because Mark wasn't introduced, I think for you, Brandy, or anyone else that really is new to AFBS, Mark, along with his wife, founded this organization and volunteers as its executive director. And thank you, Stephanie, for being on the call, and for each of you and what you brought to this. Again, just to restate that I'm really here to help facilitate a repair process, something that makes new connections possible, to create an increased representation, exactly what Carol was talking about and many of us were talking about, to increase representation within the adult affected NM community in support of the important work that AFBS is doing. So that is also including in advocacy and education, forming new collaborations, and encouraging a future where there are more treatments available or possible for the coming generations. And this is something too that I often think about in my work with a lot of different communities, is what type of decisions and commitments, aspirations, and work are we doing now that addresses the current needs, the needs of our own lives or the ones we love and care about, while keeping in mind the lives of people who have children, right, who have not yet been born, but will be born into this community, whose parents will be parenting within this community, who will very likely mature into adults like many of you. What are we doing now to just create more possibilities for them? And sometimes those possibilities are treatment-based and medical intervention. Sometimes they're policy-based, like the fact that Anna is fortunate to live in a country where the policies are quite different and a lot of things are more readily available. So there's a whole slew of ways to address this, but anything I believe that we can all do, and certainly the staff at AFBS, to repair past harm, to create more allies and committed members from the adult affected community, is something that I think is wholeheartedly acknowledged and welcomed. So that's really why we're having this call, and my hope is that dialogue like this can continue, either in future calls or through your connections with the organization. And I would say, though we're going to close here, we can leave the call going for a couple minutes if people want to connect in the chat, or you can do direct messages. I heard a lot of you say in the beginning, this is one of your first times, Mary, I think you said one of your first times connecting with other adults with NM. So what an opportunity. I don't want to just say bye, have it close off. Take a minute now if there's things you want to say to the group or individually, or share your personal contact with someone so you can continue the conversation. Let's use the next 5 minutes, I'd say, just as a collective resource. And thank you all for your time.
I have an idea. During the pandemic, the children had a Zoom group together because we weren't able to see each other in America. And it was really fun. They talked about daily things they did, what they did when they didn't go to school, and so on. And an idea would be that we as an adult did the same. Zoom group, every second month or whatever, to just say hi to each other, see how life is going on, and share experience and give each other advice and just be there for each other. That's the thing that I think that if we could get help with from APFS so we can start it, I think that would be really fun and great and also very helpful. That was all from me.
Thank you, Anna. Does anyone else want to say something? I see some activity in the chat. But yeah, I think that's a terrific idea, and probably people will hear that and there'll be some type of response if that's something that's possible. Carol, did you want to say something? I saw you come off mute.
I unmuted because I had put my email in the chat as a way to get that started, that exact thing started. Great. So that people, and I made a list of, people and stuff, but yeah, if AFBS wants to be involved in it, that's okay too. Or BA.
I would just say, anyone that would like to be in contact with me, you can find me on Facebook or what have you. Or if you want to email me, I can put my email in the chat. I know one other person with NM. So I don't have anyone in my family that has it. I'm the only one, so I don't know many people. So it's nice to see all of you and hear you.
Thank you, Brandy. And I have to say, if this really is your first time, like knowing about the organization or joining a call, your voice was heard, and it was great to see you. So welcome.
Thank you. Thank you.
Well, this is the moment in a Zoom conversation where no one wants to leave or to be the first one to leave. So you're all free to go and resume your day. Thank you again. And again, as someone who is learning more about this community and being welcomed in really as an advocate and as an ally, I think it's very ripe for a lot of great connections and collaborations to happen. So I feel really grateful also to AFBS for inviting me in.
I will say good night to everybody, and I will watch the Swedish contest to take out someone for the Eurovision contest in music. So it's late now in Sweden, and have a good time. And hopefully we see each other soon. Take care. Bye.
Thank you. Bye.